Hi everyone, in this video I'm going to discuss about the nursing care of patients undergoing thoracentesis. I am Julian K. Thomas, faculty working in M College of Nursing. The objectives include the group should be able to state the structure of pleura, define thoracentesis, brief the purposes of thoracentesis, enlist the indications of thoracentesis, list down the contraindications of thoracentesis, describe the nursing considerations during the procedure, explain the complications of thoracentesis. Pleura. What is a pleura? Pleura is a tissue which covers the lungs. The lung is covered with a tissue called the pleura. The inside of the chest is also lined with pleura. So the lining of the lung parenchyma is known as the pleura. So there are two layers of the pleural cavity, that is the visceral pleura and the parietal pleura. So visceral pleura which lines the lungs, and the parietal pleura which one is the outer one, outer covering of the lungs. So space between the visceral and the parietal pleura is filled with a small amount of fluid that is known as the pleural fluid. The layer between the visceral and the parietal pleura is filled with a small amount of fluid that is known as the pleural fluid. So the body produces pleural fluid in small amounts. So the main function of this pleural fluid is to lubricate the surfaces of the pleura. So there won't be any friction between the visceral and the parietal pleura, and also it will helps the expansion of the lungs. So the body produces pleural fluid in small amounts to lubricate the surfaces of the pleura. It lines the chest cavity and it surrounds the lungs. So pleural cavity contains a relatively small amount of the fluid, approximately 10 ml on each side will be there. But when this fluid which comes in excess, so large accumulation of fluid in the pleural cavity due to some infection or due to some inflammation, that will end up in some complications or some disease condition. So that is known as a pleural effusion. A pleural effusion is an abnormal excessive collection of pleural fluid in the pleural cavity. What are some of the conditions that can result in pleural effusion? So the space normally contains just a thin layer of fluid. However, some conditions such as pneumonia, some types of cancer or congestive cardiac failure may result in pleural effusion. So excessive amount of such fluid can impair with breathing by limiting the expansion of lungs during respiration. So when there is excessive fluid which is present between the visceral and the parietal pleura, so this will cause a limitation of lungs to expand. So the patient will manifest with the signs and symptoms of breathing difficulty. When large amount of fluid is present between the visceral and the parietal pleura, so this will cause the patient to have breathing difficulty. So how we can remove such signs and symptoms of breathing difficulty for the patient? There comes the procedure thoracentesis. Thoracentesis is a procedure that is done to remove a sample of fluid from around the lungs. So thoracentesis, it is also known as pleural fluid analysis. It is a procedure in which the needle is inserted through the back of the chest wall into the pleural space. Pleural space, already as I mentioned, that is a space exists between the two lungs and the anterior chest wall. So this thoracentesis helps to remove the fluid or air. So pleural fluid analysis, it is the microscopic and chemical lab analysis of the fluid which is collected from the pleural cavity to identify what type of microorganism which caused the infection. So a thorough analysis of the pleural fluid will be done in the laboratory to rule out the cause of the thoracentesis. The purposes of thoracentesis include to determine the cause of abnormal accumulation of fluid in the pleural space. So what is the reason why there is an excessive accumulation of fluid in the pleural cavity? So it also relieves the shortness of the breath and the pain. Due to the collection, the patient will have the symptoms of breathing difficulty. When we remove the excess amount of fluid from the pleural cavity, which will relieve the shortness of breath for the patient. And also this thoracentesis can be done as a diagnostic or a treatment procedure to drain large amount of pleural fluid to equalize the pressure on both sides of the thoracic cavity. The indications of thoracentesis that can be divided into two. Either it can be of diagnostic or for a therapeutic purpose. So diagnostic, to rule out, to identify what is the reason for the excessive collection in the pleural space, and therapeutic, to relieve the signs and symptoms, to give comfort to the patients. At a therapeutic management also we can do thoracentesis for the patient. So the diagnostic purpose include determination of pleural effusion etiology. What is the reason for the collection of fluid in the pleural space? Pleural fluid analysis to distinguish between whether it is an exudate or transudate, whether it is a clear fluid or it contains cells and fibrins, or that can be as a result of infection. And also to do a pleural biopsy, this thoracentesis can be used. Coming to the therapeutic indications of thoracentesis, a removal of fluid and air from the pleural cavity, reduce dyspnea and respiratory compromise in patients with large pleural effusions, and also installations of medications into the pleural space to relieve the infections or the inflammation. So these are the two indications of thoracentesis. Either it can be used to rule out what is a reason, or it can be used to relieve the symptoms of pleural effusion. Coming to the therapeutic indications of thoracentesis, in which are the disease conditions we can use thoracentesis, which include traumatic pneumothorax when there is air which is filled in the pleural space, hemopneumothorax when there is a collection of blood in the pleural space, spontaneous pneumothorax, bronchopleural fistula or pleural collection of fluid in the pleural cavity, that is pleural effusion. Contraindications of thoracentesis include if the patient is not cooperative, that is an uncooperative patient, or if the patient is having some coagulation disorder. Sometimes when we do the pleural thoracentesis, there is a chance for bleeding. So if the patient is having any coagulation disorder, we should not proceed with the thoracentesis. Atelectasis, collapse of the lungs, if the patient is having only one functioning lung, emphysema or severe cough or hiccups. So if the patient is having cough or hiccups, when we introduce the needle, there is a chance of damage to the nearby tissues. So in such case also we should not proceed with the procedure thoracentesis. So what is the ideal location for thoracentesis? Where we have to approach, which part of the body we have to approach to do for a thoracentesis? So first we need to identify what is the height of the effusion. So how far the patient is having the effusion. This can be ruled out or assessed with the help of an auscultation and percussion method. So also we can use ultrasound to confirm the location. So mark 5 to 10 centimeter lateral to spine or 1 to 2 intercostal space below the effusion. So the needle or the tube should be inserted through the skin between the ribs and into the chest. So to minimize or avoid potential injury to the diaphragm, the lowest recommended level for thoracentesis is between the 8th and the 9th ribs. So that is the 8th intercostal space above the diaphragm. So what is the position we can use for thoracentesis? If the patient can sit upright, the patient can sit on the edge of the bed leaning forward and the arms can rest on the table. So that can be an ideal position for doing thoracentesis. If the patient is unable to sit upright, the patient can lie down in a supine position. The hand should be elevated. So a mid-axillary approach can be used, or a posterior axillary with the patient in the lateral decubit position. So this is the ideal position and the location where we have to proceed with the thoracentesis. The patient can be seated on the edge of the bed leaning towards, the arms will be resting on the table. So first we need to identify the height of the pleural effusion with the help of auscultation or percussion method. Then the needle should be inserted 1 to 2 intercostal spaces below the height of the effusion or 5 to 10 centimeter lateral to the spine. So make sure that we should not injure the diaphragm. So we should not pierce the needle below the 9th rib. So the nursing considerations includes the nurse's responsibility before procedure, during and after procedure. So before procedure, we need to check the doctor's order. What is the reason why we are going with the thoracentesis? Identify the patient correctly. Ask the patient to sign a consent form that gives you a permission to do the test. So why we need to get a consent from the patient? We should explain the procedure. What is the reason for thoracentesis? The person who are going to do the thoracentesis should explain the procedure to the patient, and the nurse should make sure that the consent has been obtained from the patient after thorough explanation, and also the nurse should make sure that the patient has understood what is the reason for undergoing thoracentesis. So read the form carefully and ask questions if something is not clear. Then explain and emphasize the importance of the procedure. Inform that the patient will be experiencing mild pain on the site where the needle was pricked. So nursing consideration during thoracentesis procedure. So before the procedure, during the procedure and after the procedure, what are the nurse's responsibilities? So before the procedure, inform the client that the procedure takes few minutes depending on the amount of the fluid that we need to drain from the pleural cavity. So inform the client not to cough while the needle is inserted in order to avoid injury to the surrounding structures. Explain when and where the procedure will occur and who will be present. So explain the procedure to the patient because the patient will be in an anxious situation. To provide comfort and to relieve the anxiety, we need to explain the procedure to the patient. Also inform the patient may have to undergo certain diagnostic procedures such as chest X-ray, chest fluoroscopy, ultrasound, or a CT scan to rule out or find out the specific location of the fluid in the chest that should be removed. The patient also may receive a sedative prior to the procedure to help the patient relax. Ask the patient to remove any clothing, jewelry, or other objects that may interfere with the procedure. The area around the puncture site should be shaved. Monitor the vital signs, which includes the heart rate, the blood pressure, the breathing rate, and the oxygen level of the patient before doing the procedure. Coming to the procedure, so during the procedure, what is the nursing considerations? Support the client verbally and describe the steps of the procedure as needed. Vital signs should be constantly monitored during the procedure. The patient may receive a supplemental oxygen through face mask or a nasal cannula. Make sure that the patient is not having any breathing difficulty during the procedure. Observe the patient for any signs of distress such as dyspnea, breathing difficulty, pallor, or coughing during the procedure. So while doing the procedure, place the patient in a sitting position as we already discussed earlier with the arms raised and resting on over the bed table. This position helps to spread out the spaces between the ribs for the needle insertion. So there will be large space when we insert the needle. So if the patient is unable to sit, the patient may be placed in a side-lying position on the edge of the bed on the unaffected side. So the skin at the puncture site will be cleansed with antiseptic solution. The patient will receive a local anesthetic at the site where the thoracentesis should be performed to relieve the pain during the insertion of the needle. So make sure that don't remove more than 1000 ml of fluid from the pleural cavity within the first 30 minutes because it can increase the risk of post-expansion pulmonary edema. So we should stop the procedure if the patient feels any chest pain, dyspnea or cough. Remove the needle while patient is humming. Ask the patient to make a humming sound and then remove the needle, so it will reduce the risk of air entry into the pleural space. Make a small sterile dressing over the site of the puncture after once the procedure has been done. So once the procedure has been finished, observe the changes in client's sputum, cough, respiratory depth and the breath sounds, and also note any complaints of chest pain for the patient. Constantly monitor the patients, monitor the vital signs, position the client appropriately, and according to the hospital policies, we can recommend that the patient can lie on the unaffected side with the head of the bed elevated 30 degrees for at least 30 minutes because this position can facilitate the expansion of the affected lungs and which can make the patient to have an easy respirations. Position the patient in a sideline position with the unaffected side down for an hour or longer. So once we're done with the procedure, we have to document the procedure. So when we document the procedure, we should include the date and time when we have done the thoracentesis, who has done the thoracentesis, the name of the primary healthcare provider, the amount of the fluid which has been drained from the pleural cavity, what is the color of the fluid, the clarity of the fluid which is drained, and the nursing assessment and the interventions provided during the procedure should be documented legibly and or clearly with the signature of the staff. Post-procedure X-ray should be taken to rule out any pneumothorax or hemothorax after the procedure, or any air accumulation or any blood accumulation in the pleural cavity. Once if we have taken any samples from the pleural cavity, the fluid, or if we have taken any biopsy, transport the specimen to the laboratory. The dressing over the puncture site should be monitored for any bleeding or any other drainage from the punctured site. Monitor patient's blood pressure, pulse and breathing until the patient is stable, and document all the relevant information after the procedure. So the complications of thoracentesis include pain during placement of the needle, or the patient will have pulmonary edema. This can be a risk of if we remove large amount of fluid at a stretch within 30 minutes. If we are removing more than 1000 ml of fluid, the pulmonary edema can happen. Respiratory distress, air embolism, bleeding, infection, dyspnea and cough, atelectasis, that is collapse of the lungs, and cardiac tamponade, that is a fluid built up in space between the myocardium and the pericardium, the pericardial space, if there is a large amount of fluid accumulation as a result of pleural effusion. So that is known as cardiac tamponade. So these are some of the complications which can happen during thoracentesis. What are some of the nursing diagnoses we can formulate for the patients undergoing thoracentesis? Ineffective breathing pattern related to decreased lung volume capacity, impaired gas exchange related to alveolar capillary membrane changes, impaired skin integrity related to mechanical factors secondary to thoracentesis, acute pain related to surgical incision, chest tube sites and immobility, impaired physical mobility, activity intolerance. These are the common nursing diagnoses that can be formulated for a patient undergoing thoracentesis. So to conclude, a thoracentesis is a relatively simple procedure that involves using a needle to remove fluid from the pleural space. So doctors may use this procedure as either diagnostic or can be a therapeutic method of treatment. A thoracentesis may cause minor complications such as pain, bruising or bleeding at the puncture site. It may also cause more serious complications such as infection and pneumothorax. Nurses should have skill to assess the procedure and should rule out any complications at the earliest. These are the references. Thank you.